Good morning, lecturer and fellow classmates. Today, our group will present on metabolic disorder and environmental safety for our biochemistry course. Our body engine. Think of our metabolism as the body internal chemical engine. It constantly runs on two pathways. Catabolism, which breaks down food to release clean energy, and anabolism, which uses that energy to build and repair our cell. When this pathway face roadblock from genes, environmental pollutant, or organ strain, metabolic disease happen. The body either build up toxic waste or run out of essential resource. The 5 disorders. Today we'll briefly cover 5 major disorders: diabetes, hypoglycemia, lactose intolerance, acidosis, and atherosclerosis. I will now pass the floor to Connie to discuss diabetes.
Thank you, Shukor. Diabetes happens when there is an insulin deficit or cellular resistance, leaving sugar trapped in the blood instead of feeding our cells. The 3 types. Type 1, systemic autoimmunity. The immune system mistakenly destroys insulin-producing beta cell in the pancreas, so the body cannot make the key to transport sugar. The type 2 is a silent resistance. The pancreas makes insulin, but cells stubbornly ignore it. This type is heavily tied to high-fat diet, weight, and sedentary lifestyle. And the 3rd type is a gestational. This is a temporary hormonal shift during pregnancy that increases the risk of developing type 2 diabetes later in life. A sign and management. Look out for the classic trait: frequent urination, extreme thirst, and constant hunger. The type 1 requires a daily insulin, while type 2 is managed with active lifestyle adjustment, weight loss, or oral medication. And next, Alafik will cover our next 2 topics.
Thank you, Koini. For my part, I will explain about hypoglycemia and lactose intolerance. Since diabetes means high blood sugar, hypoglycemia means critical drop below 70 mg per dl. Since the brain relies on glucose for fuel, a sudden drop triggers an adrenaline spike, causing cold sweats, shakes, rapid heartbeats, and severe anxiety. In the protocol, we manage this using rule of 15. Eat 15 grams of simple sugar like juice or candy and wait for 15 minutes and recheck the blood level. If a patient faints, never force liquids. Give emergency glucagon or call for a medical help immediately. For lactose intolerance, or we call the dairy dilemma, lactose is a double sugar found in milk. Normally, our intestine produces an enzyme called lactase to break it down. As we age, our bodies naturally slow down or stop making this enzyme. And what happens? The undigested lactose travels straight to the large intestine, where bacteria ferment it rapidly. This creates lactic acids and carbon gases, leading to cramps, bloating, and watery stools within 30 minutes to 2 hours. It can be diagnosed using a hydrogen breath test and managed using glucose-free alternatives or lactase tablets. And now, Clintino will explain about acidosis.
Thank you. And now, I'm going to present about acidosis, the pH balancing act. But first, you need to know what is acidosis. Acidosis is a serious failure to keep our body pH steady. When blood pH drops below 7.35, the body system slows down, causing heavy headache, confusion, sleepiness, and muscle weakness. There are 2 types of acidosis. The first one is metabolic acidosis that occurs when the body uses basic bicarbonate or build up metabolic acids. The triggers include ketoacidosis, which means burning fat for fuel, lactic acidosis, with lack of tissue oxygen, the kidney failure, that means unable to filter organic acids, or severe diarrhea that happen when the body is flushing out too many bicarbonate. The second one is respiratory acidosis. This happens when lungs fail to exhale carbon dioxide. It is triggered by lung diseases like COPD, asthma, sleep apnea, or drug overdoses that slow down breathing. But how does acidosis being treated? The metabolic acidosis is treated by curing the core causes, giving fluids, or using a sodium bicarbonate 4 buffer. The respiratory acidosis focuses on clearing the lungs using albuterol nebulizer, supplemental oxygen, or mechanical ventilator. I will now hand over to Nemesio to wrap up our presentation.
Thank you, Quintino. Our final disorder involves the vascular system. Healthy arteries are smooth and flexible, but when the inner lining is irritated by smoking, high blood pressure, or processed diets, it becomes inflamed. The body tries to fix this damage, but accidentally traps lipids, white bloods, and calcium, creating a thick sludge called plaque that block oxygen-rich blood. Doctors use medication like blood thinners and statins to stabilize the plaques. For severe cases, surgeries like angioplasty or using balloons to squash plaques or bypass grafts are performed to detour around the blockage. In conclusion, our metabolic pathway are delicate chemical networks. While our genetics write the code, our daily environment and lifestyle choices determine how well they run. Choosing an active life, avoiding environmental toxins, and embracing balanced nutrition are our best shields to keep our internal engines running smoothly. That's all from our group. Thank you for your time.